Did you recently have a total knee replacement? Have you finished your physical therapy sessions and are wondering what you can do now to keep improving your strength and mobility? Keep watching for 12 simple exercises that you can do today that'll help you continue moving down the road to complete recovery. My name is Franklin Staples. I am a licensed physical therapist at EW Motion Therapy in Birmingham, Alabama. I understand how difficult the rehabilitation process can be after a total knee replacement. Once you are done with 3 months of physical therapy, the recovery process isn't magically over. This video is designed to help you after you are discharged from physical therapy by teaching you 12 easy exercises that you can do at home to keep improving your knee mobility and strength. I need to add a short disclaimer here that no point during these exercises should your knee or any body part hurt. While they may feel uncomfortable at times, all these exercises should be performed pain-free. So, if you are feeling any sort of pain at any point, stop and consult a healthcare professional before you continue. Now let's begin. This exercise is called a squat. It can be done utilizing a chair or an open space. Squats help improve your knee stability and strength, as well as your hip stability and strength. Squats also help improve your ability to transfer in and out of chairs or on and off the toilet. So we're going to start by getting our feet shoulder width apart. And you want to initiate your squat by hinging at your hips. So you're going to drop those hips back a little bit and then bend at the knees. Now when you're first starting to do squats, don't go very low. Start really easy and get comfortable with them. And then to progress them, you can start getting lower or even adding weight to your hands. Good. For this exercise, you can do 3 sets of 15 repetitions. This exercise is called a bridge. A bridge is typically completed on a mat or a soft carpet. This exercise is good for working on core, lumbar stability, and glute and hamstring activation, along with some lower back activation. It also helps you improve your ability to transfer in and out of bed and in and out of chairs. So you're going to start with this exercise by placing your arms down by your side, just like so. And then you want to slide your feet back as far as you can. And then you want to begin by rolling your hips back so your back is flat on the table or the ground. And then you're going to drive your heels down the ground and lift your hips up off the ground, just like that. And then go back down and repeat. Now, it's important with this exercise not to plop down, but control yourself down, just like he's doing here. And then to progress this exercise, you can try on one leg. So what we'll do is have him straighten out his non-surgical leg, his left leg, and try a single leg bridge. Relax down. Now for this exercise, you're going to want to perform 3 sets of 15 repetitions. The next exercise is called the lumbar flexion stretch and will require a Swiss ball to be performed. The benefits of this exercise are that it will help reduce lower back tension that can occur the first few months following a total knee replacement. So you're going to begin in a chair and then you're going to slide to the edge of the chair. Okay? Place your hands on the ball in front of you. And for this, you're just going to roll the ball forward, tracking it with your hands, and you're going to go as far forward as you can until you feel a big stretch in your low back. You're going to pause and hold for 5 seconds. Feel that nice stretch, and then just roll it on back, nice and easy. Sometimes it helps to spread your feet apart wider so you can have a little bit more room to go forward. And for this exercise, you're just going to perform 10 reps with a 5-second hold at end. Now we are going to do an exercise called the Windmill spinal rotation. This exercise can be done on a mat, on a carpet, or leaning against a chair. This exercise will help improve back tension that may come from compensating while walking with a total knee replacement. It'll also help to improve your thoracic mobility. So begin by placing your hands on the countertop or the back of a chair. Make sure your spine is straight. You don't want a big arch in it. And then you're going to take your arm and open up like you're trying to touch the ceiling. Pause for 2 seconds at the top and then come back down. And if you're doing it right, you should feel a little bit of a stretch in your upper back and lower back. And you want to perform this exercise for 15 repetitions with a 2-second pause at the top. The next exercise is an elephant walk. For this exercise, you can use a yoga block or chair depending on your flexibility. The elephant walk focuses on knee extension mobility and quad/hamstring facilitation. So what you're going to do is place your hands on the table in front of you, or a low chair or a stool, and you're going to get a little bend in the knees just like so. Make sure your back's a little curved. And then what you're going to do is alternate straightening each leg. So you'll see he'll alternate straightening that left leg and then it'll follow straightening with the right leg. And if you're doing it right, you should feel a big pull on the back of your leg. Now to progress this exercise, you can put your hands on a lower surface, and that's going to put even more of a stretch on the back of your legs. And for this exercise, you're going to want to perform 2 sets of 15 repetitions. This exercise is called a step up or step down. All that is required for this exercise is a step or a set of stairs. This exercise will help you on progressing your ability to step up and down stairs while building up your knee and hip strength. For the step up exercise, you're going to begin by placing your surgical foot up on the step in front of you, and then you're going to follow it with the corresponding leg, and then you're going to do the same thing in reverse off of the step, so leading with that non-surgical leg on the way down. What you want to think about when doing this is that you're pressing through your heel of the foot when you're pressing up, and being sure that you're not moving your trunk too much, but keeping your back straight. And then for the step down, you're going to do the opposite. You're going to go down with the non-surgical leg and back up with the surgical leg. Same principles apply here. Make sure that you're keeping your back straight and you're emphasizing getting that foot underneath you as you step back up. For this, you're going to want to perform 10 steps up and then 10 steps down. Now we're going to do a split squat. All that is needed for this exercise is an open space and possibly a 5 to 20 pound dumbbell, kettlebell, or weighted ball. This exercise helps improve your single leg mobility and stability while improving your balance with a narrow base of support. Doing this exercise will help you feel more confident with walking and taking longer steps. You're going to begin by taking a big step forward with your surgical leg, and then keeping your back straight, you're going to drop the other knee down as low as you feel comfortable and then come back up. Now, when you're first doing this exercise, you may need to hold on to something like a chair or like a stool. And when you're first starting out, you want to go very low depth. So you don't want to go too deep to where you can't get back up. But as you progress, you can drop your knee lower and lower to the ground. For this exercise, you want to perform 3 sets of 15 repetitions. The next exercise is called backwards walking, and all you will need here is a potential wall for stability or a hallway and or sidewalk. Walking backwards will improve your ankle, knee, and hip mobility while also working on your dynamic balance. So for this exercise, you're going to simply walk backwards, but you want to begin by taking very small steps and possibly using your eyes to look at your feet so you feel more confident. And then as you get more comfortable with it, you can begin to take larger steps and keep your head up. And that's really going to focus on the dynamic balance aspects of this exercise. Good. And for this one, you're going to want to do 3 sets of 20 steps backwards. The next exercise is called a suitcase carry. All the equipment needed for this is a weight that you can hold in your hand in a hallway or a long room to walk back and forth in. The suitcase carry exercise improves your core, back, and hip and knee stability with ambulation, while also improving your dynamic balance. To begin this exercise, you're going to need a weight to hold in one hand. Now, when you initially hold this weight, you may find yourself leaning towards the side of the weight, but it's very important that you try to correct that posture and counterbalance the weight using your muscles. And what you're going to do is just walk back and forth in a hallway or outside with this weight in your hand, not letting your body compensate for the weight on that side. Good. And to progress this exercise, you can do it with a heavier weight. And you want to kind of perform this one for 3 sets of 20 steps. This next exercise is called a banded side step. All that is needed is a long hallway or an open room and a band to place around your knees. This exercise will help improve knee stability as well as hip stability and strength. Banded side steps also help improve your dynamic balance. Begin by placing the band around your legs. Now, to start this exercise, you can begin by placing it above the knee, and then as you get more comfortable with it, you can lower it to even the ankle at the end of your exercises. But you're going to start by getting a little bit of a squat and keeping tension on that band at all times. You don't want it to fall down, and you want to keep your toes facing forward. And you're going to step to the side, focusing on keeping tension through that band and making sure that your toes don't point out as you step. And like I said, when the band goes lower on the leg, it's going to make it a little harder. So you can use the same band and progress it by just lowering it down to the ankles. And for this, you're going to want to do 10 steps to the right and then 10 steps to the left. This exercise is referred to as a toe raise or heel raise, and all that you need to complete this is a wall or a chair. This combination of exercise helps improve the strength of your lower leg, which will provide more support for your knee. You can begin by placing your hands on the back of a chair, and we're going to raise our heels off the floor as high as we can. Now, when you're doing this, be sure not to go forward with your body, but think going tall with your body, just like that. And you can perform 3 sets of 20 repetitions of heel raises. And then we're going to do toe raises. Same idea, you're just going to lift your toes up and be sure you have a good grasp, because when you initially lift your toes up, you may feel like you're going to lose your balance a little bit. But you're going to perform 3 sets of 30 repetitions, raising your toes off the floor. Now we're going to do the wall sit or wall squat. This is an exercise that only requires a sturdy wall and a shirt fabric that slides well. Wall sits help with knee stability and strength while in a squatted position. This will help you improve your ability to transfer in and out of chairs, as well as get on and off the toilet. Begin by leaning against the wall and taking about a shoe length step away from the wall, ensuring that both feet are even. And then you're going to slide down the wall. Be sure not to go below 90 degrees of knee flexion. Hold that position. Be sure to keep your back flat against the wall, not arching your back too much. And you're going to hold this position. Now you can start by holding it for 20 seconds, and then as you get stronger, you can progress your way to 30-second holds. Thanks for watching. This video was designed to help you keep up with your movement and fitness goals while you recover from a total knee replacement. If you'd like other ways to continue to build strength and mobility, check out our personal training program by visiting our website linked below. If you aren't sure if this could be the right step for you, watch our video, Physical Therapy versus Personal Training, linked in the description below. This video breaks down the differences between the two practices so that you can decide what would work best for you. Thank you. Have a great day.